Hello, my name is Cecilia and I'm doing my head to toe comprehensive head to toe assessment on my uncle. His name is Uncle Sally. I've done my environmental check, I've done my hand hygiene, I've assessed my patients. Do you have anything today?
No.
No. Okay, so I'm gonna be doing head to toe assessment on you. Is that okay?
Okay.
Okay. First I'm gonna start by naming the lymph nodes. We have pre-auricular, post-auricular, occipital, the tonsillar, submandibular, submental. We have the anterior cervicular, posterior cervicular, and then we have the super cervicular. While I was palpating, did you feel anything?
No.
They are non-palpable. The next, I'm going to go ahead and start naming my cranial nerves. So I'm going to start with cranial nerve number 8. Cranial nerve number 5, which is the trigeminal. Uncle Sandy, I'm going to be checking for the motor and sensory. So for the motor, I'm going to ask you to, I'm going to palpate over the metasag muscle. I'm going to ask you to clench your teeth, your jaw, clench your teeth like you're chewing. Okay. Cranial 5 is intact. And then for the motor, I'm going to ask you to close your eyes and I'm going to be touching on places on your face. You tell me where I touch.
My forehead, hand, my jaw,
Cheek.
my cheek,
Chin.
chin.
Okay. So cranial nerve number 5 is intact. Next, we're going to assess cranial nerve number 7, which is the facial. So I'm assessing for facial symmetrical. So I'm going to ask you to smile for me, frown for me, frown, pop your cheek for me, and then pop up your lip. Alright, so cranial nerve number 7 is intact. Next, I'm going to go to cranial nerve number 8, which is the acoustic. And while doing that, I'm going to assess the external auditory of the air, external canal of the air. Gonna pull the pinna up and back and go with the ophthalmoscope all the way in. Okay. I'm gonna do it bilaterally. Okay. Upon assessment, I don't see no cerebrum, no drainage, no swelling, and the internal external canal is clear. And did you feel any pain while I was doing that?
No.
Okay, so with that, I'm gonna go ahead and whisper 3 words to check the acoustic for hearing. So he will repeat what I said. So I'm gonna do it bilaterally.
Yellow.
Blue.
Blue.
Pink.
Pink.
Black.
Black.
Purple.
Purple.
Orange.
Orange.
Alright, so cranial nerve number 8, which is the acoustic, is intact. The patient repeated what I said. Next, I'm gonna go ahead and assess cranial nerve number 2, which is the optic nerve. I'm gonna bring my finger in. Let me know when you see my finger. See it? And then see?
Yep.
Alright. The next one, I'm gonna go ahead and assess the that one was the peripheral vision. Next, I'm gonna assess for pupillary response. I'm gonna bring in the light, so alright. And then the next one, I'm gonna go ahead and assess for blood vessel. I'm gonna assess blood vessel in the eye. Oops. Okay, so I'm gonna go in with my ophthalmoscope and look right into your eye. Open your eye, see? Okay. Next one. Alright, so the pupils are measured 2 to 3 millimeters and they are reactive to light. The next one I'm gonna assess is cranial nerve number 3, 4, and 6. 3 is oculomotor, 4 is the trochlea, the 6 is abducens. This we are checking for extraauricular movement. and I want you to, I'm gonna draw a H, so pay attention to the pen, okay? All right. Cranial nerve number 3, 4, and 6 is intact. The next I'm gonna assess cranial nerve number 1, which is the olfactory. With that, I'm gonna go ahead and assess the nose. I'm gonna assess the turbinate and the septum. Jesus. Let's go with camera. I'll put it on this one. Okay. All right. So I'm gonna pull the tip of the nose up. Do my assessment. I'm gonna use a pen light in there. All right. Upon the assessment, I do what's the name of it? This one is disturbing me. The turbinates are pink moist, and then the septum is midline. I don't see no deviation. I don't see no exudent or hemorrhage. Next, I'm gonna go ahead and palpate the frontal and maxillary sinuses. Let me know if you feel any pain. No. Yeah, take this phone. Did you feel any pain when I was assessing? Okay. Then next I'm gonna give you something to smell. You let me know what you smell. What did you smell? Mint.
Mint.
So cranial nerve number 1 is intact, and then now I'm gonna assess the mouth and the throat. So I'm gonna use my pen light and see. Can you open your mouth? Say teeth. Can you wiggle your tongue out? Take off your tongue and wiggle it. Okay. So upon assessment, the lip is moist and pink. The gum is moist and pink. The tongue is moist and pink. The teeth, I don't see no decay. I don't see no cracks. And the palate is pink and moist. The floor of the mouth is pink and moist. I don't see no drainage. The palate is pink and moist. And posterior pharynx is pink and moist. I don't see no drainage. The gum, I don't see no drainage. And the while the patient say I saw the soft palate rising with phonation. So cranial nerve number 9 and number 10 is intact. Next, I'm gonna go to cranial nerve number 11. Number 11, I'm gonna shrug your shoulder and then you can upon resistance, okay? All right, cranial nerve number 11 is intact. The next I'm gonna go, okay, so cranial nerve number 9, 10, and 12, hypoglossal, is intact while I did the mouth assessment. Next I'm gonna go to the throat. The trach is midline. And then I'm gonna assess the thyroid gland. So I'm gonna press on the thyroid here. I want you to swallow. Did you feel any pain? No. Okay. I don't feel no masses. It's not palpable. Next, I'm gonna go ahead and listen to the carotid artery. I'm using the bell of my stethoscope. Okay. I'm listening for any breath. All right. All right. I don't hear no breath. Everything looks normal. Next, I'm gonna go ahead and assess the hand grips. Go down to the upper extremities. Can you squeeze my hand with force? All right, grips on hand is 5/5. The next one we're gonna do is the elbow. Can you, I'm gonna assess for the, fold your hand like this, both of them, and I'm gonna press on resistance. The strength bilaterally, and 5/5. The next one we're gonna do the extension, flexion, abduction, and also can you fold one hand for me? and straighten out. That's extension and flexion. So now we're gonna do another one for the shoulder. So can you lift your hand all the way up, straight? All right, and then can you bring it down, all the way down? Okay, so can you put your hand all, like when I bring it down, bring it like you're doing an uppercut for me. That's an extension. So okay, good. So can you bring your hand in to your body? That's a good inward rotation. Just do like this, and then can you take it out, fold it, and take it out? That's an outward rotation. Can you put your hand all the way to your back? That's a perfect abduction. Can you bring your hand all the way to your arm? That's a perfect adduction. And now I'm gonna do the cerebral coordination. So you're gonna touch the tip of your fingers for me. Touch the tip of your finger. Okay. Okay. The next one we're gonna do. You tap on your knee like this. Do it fast for me, fast. So both are bilaterally coordinated. They are intact. The next, we're gonna go ahead and listen to the heart. All 5 areas of the heart using the bell and the diaphragm of the stethoscope. So we're gonna start with the aortic, pulmonic, the abs point, tricuspid, and the mitral. The same with the bell of the stethoscope, aortic, pulmonic, abs, tricuspid, and the mitral. I don't hear no breathe. Everything, the breath sound is normal. I'm gonna go ahead now and assess the anterior part of your chest, the lungs, which for breathing, for normal breathing, and I will note I'll note normal breathing or abnormal. So I'm gonna start here from the anterior. Can you breathe for me? And I'm gonna do it side by side. All right, the lung sound is clear, and I'm going to the posterior, starting from the scapula. Can you turn your back this way? All the way that way. And I'm gonna do it side by side. Can you take a deep breath? Gonna listen to the base, the middle. Lung sound is clear. Breath is clear. Turn this way again for me. So turn this way. All right. So now, the next thing we're gonna assess your abdomen. So I want you to lay down for me on the couch, please. Abdomen. I think, yeah. So we're gonna start. First, I'm gonna auscultate for bowel sound, starting from the lower quadrant to the upper quadrant. Bowel sound present in all 4 quadrants. The next, I'm gonna listen to all the 5 areas of your abdomen, starting with the aorta, which is right above the Ziegfeld process. And then I'm gonna go to the left, the right, the left center, left, and then go down to the left, right iliac, and left iliac. The sounds are clear. I don't hear no abnormal sound. Next, I'm gonna go ahead and percuss for tympanic. Starting from here. All right, so the next one I'm gonna palpate. Let me know if you feel any pain while I'm doing that, okay? don't feel no it's non-palpable and it's non-tender.
Pain.
Okay, so the next one I'm gonna assess for the spleen and the liver. So for the liver, I'm gonna go with my left arm under the costovertebral angle and press down and up while the patient take a deep breath to feel the edge of the liver. Just lay down straight. Just lay down straight. I think I need to bring this, and this was the one she was concerned about. Okay. I'm gonna put my hand down there. All right, take a breath. All right. And then now the next one is gonna be for the spleen. I want you to lean on your side. Good. And then, yeah, just put your knee right. And then put your hand. I'm gonna go to the same the costovertebral angle, and I'll press down and up while you take a deep breath to feel the spleen. I don't feel the spleen, which is normal. Next, I'm gonna assess the lower extremities. So I want you to lay back on your back. We're gonna start with the hip. We're gonna start with flexion. Can you put your knee up? Good flexion. Extension. Can you put your leg away? Good extension. And then we're gonna do internal rotation. Put it over here. Good internal rotation. And then external rotation. So the next, we're gonna go to the knee. So the knee, we're gonna all right. We're gonna check for the strength of the knee. So put both knees up, and I'm gonna push toward easy stance. Strength is 5/5, and I'm gonna push dorsiflex and plantarflex on the knee. Can you lift your feet up? No, put the feet up. Okay, stand and then push down on this. Okay, and I'm gonna do internal and external rotation on the foot, on the knee. So this is internal rotation, external and internal, external rotation. So on the ankle, I'm gonna do a rotation on the ankle. So this is it. Then I'm gonna dorsiflex. Can you press down? Press down and no, press up, push up. All right, and then plantarflex. Okay. All right, I want you to stand up. All right, we're gonna do spinal stance of the spine. Okay, so you're gonna bend all the way and touch your toes, and then stand up. All right, bend sideways, and then bend the other way. And now you're gonna move your torso. Move your torso. Okay, so there's strength in the spine, 5/5. The next one we're gonna do is the lumbar check. So you're gonna put your legs together and hand and close your eyes, and I'll count 20. 1, 2, no, just close your eyes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. All right, so I didn't see no swing. Now we missed one of the assessments. I want you to sit down. So we're gonna assess the biceps and the triceps. I skip that, but we're gonna do it, okay? So give me your hand straight, and then we're gonna use the hammer on the inside. Okay. All right, we're looking for a contraction here, which is present. The next one, we're gonna go ahead and check the patella. So I need you to your knee, and I'm gonna check for function. All right, so the next one is gonna be the Achilles. So you're gonna press down your feet, and can you lift it up? All right, and then all right. I think that's all we have. Did you feel anything while we are doing that?
No.
Okay. All right. Thank you very much for being a volunteer for tonight for my assessment. Thank you.